With school back in session, many parents are already bracing themselves for the inevitable back-to-school germs. Dr. Troy Russell from Teladoc Health joins us to give us the best practices for back-to-school health. Thanks for joining us.
Thanks for having me.
Of course. So you have some tips, I guess, to help parents ease back into the school transition when it comes to germs.
Absolutely. And I think it's important that there's a lot of considerations for family members and students returning to school. I also want to put it in context that we would expect a normal increase in upper respiratory infections during this upcoming season in the fall and winter. We are not returning back to the height of the COVID pandemic. I just need to lead with that. But on top of that, I want to reinforce that there are some behaviors, some practices that we adopted during the COVID pandemic that apply in this situation as well. Greater emphasis on hand washing and sanitation. I do recommend everybody listening to have small bottles of hand sanitizer available to them on their person, having it in the office, have it at home, in the car, their purse, wherever it may be. Also, when someone's exhibiting symptoms, having sneezing, coughing, I do recommend coughing into your elbow and not into your hands. And when you're noticing that you're starting to have symptoms like that, or somebody else, I'd like you to have a mask on hand for you and your children. Not something that we need to keep on all the time, but having it available so that if you are noticing that risk is increasing, either for other people because you're exhibiting symptoms or someone else you're noticing in your vicinity, it's best to protect yourself and your children.
Yeah, Dr. Russell, you did list some, I guess, great practices. What are some things that parents can actually do to help combat those back-to-school illnesses at home, maybe?
So I'm a primary care doctor by training, and I can't help but think that connecting with your primary care doctor before this flu season and potential increase in RSV and COVID symptoms, by having your preventative visits all taken care of, all your immunizations long before this season shows up. CDC recommends getting those vaccines within the third week of October to get best coverage during the flu season. And I'd encourage all of your viewers to check in with their primary care doctor about their respective health conditions and how they may play into and the timing of when they may get a COVID booster if it's necessary. At home, I think it's important to have a sit down as a family, talk about your general philosophy and treatment, and understanding that first, we don't want to stigmatize anybody who has illness. That really it's important to not make them feel isolated, but it is important to make sure that we're not spreading it among family members. If you're like me in my household, when one person gets it, everybody else gets it, and it's a major disruption to the family. And I assume many of your viewers feel the same way. So by making sure that we're stopping that prevention from preventing that transmission at school, at work, in the general community, would be greatly appreciated.
And what exactly is telemedicine? It's on the rise right now, and what can actually be treated virtually?
It's a good question. This is something that we get very frequently. Telemedicine is simply the modality, the means by which the care team and the health professional will actually connect with the patient and their family. This could be a video call. This could be an audio call. It could be synchronous or asynchronous messaging, text messaging, lots of different ways that you can connect. But they've been doing telemedicine a long time. As soon as they had phones, they were able to communicate and provide assessment and treatment plans for patients. So this is no different. So the formalization of telemedicine into practices has been really one consequence of the pandemic. And what I'd recommend most people do is if they have the option to request telemedicine visits of their primary care doctor, because they can address acute issues like coughs, colds, any chronic disease management that doesn't require a physical exam, and even preventative visits can be addressed through telemedicine. So people would be surprised on how much they can address.
I bet. Dr. Russell, before we go, how can people reach out to you and find out more information?
Absolutely. So I do recommend if people are interested in Teladoc, they can reach out on teladoc.com or reach out to their respective health plans to see if they have benefits with Teladoc or another telemedicine provider.
All right. Thank you so much for joining us here on Midday.
Thank you.